So I'm Dr. Iffat, your mentor for today's session. I hope you all are doing well, and I'm so excited to have you all here for today's session. So overwhelmed and so happy to have you all. And my session for today, as you all know, is regarding your guidance to the OET test day. So it's great to be here and to be able to help you all out. Such exceptional individuals who are out there who are working so hard and who are basically, it's a great honor to help you out through your OET journey. So if you all are on board, we can start the presentation. Right, so can I start now? Okay. So, I hope you've learned so far. You guys have a lot of information regarding what OET is. Mentors before needed an exceptionally good job in helping you out. And we at Med Exams, for the entire team, our mentors, were working very hard to provide you all with the latest updates, latest knowledge regarding OET, our sessions. We're working hard to make our sessions very fruitful for you all so that you can all pass your OET with good marks. And it's going to be these sessions will be very helpful for you in helping you out in orienting your information and helping you learn new skills so that you can execute all of that on the test day. And that's what my session for today will be about, right? So you all have learned so far the basic knowledge about OET, what OET exam is like, what different subtests there are in this exam, and regarding every subtest, every mentor has explained very well, right? But it all comes down at the end to the test day. So no matter what sort of preparation you have, until or unless you don't execute that knowledge and the skills you've learned on the test day, you will not score well, right? So even if you have not prepared well, but you're confident and you know how things are going to happen in the examination hall, you know the orientation, you're logistically prepared, you're going to score well in the OET test. So it's all about confidence. So remember, you need to be confident throughout your journey. You guys have reached here, you guys have reached this far, that you guys are exceptional. And OET is just a very simple exam in front of all those exams that got you here, right? So just believe in yourself and just trust your instincts, just believe in yourself and just do your very best, give your best out and just be confident. So my session for today will be just a guidance session for you all, what sort of, how you'll experience, what sort of things you need to be prepared for during on the test day, and how things will proceed, right? Tried my best to make this presentation very interesting for you all, and I'll try my best not to bore you guys. Even if I do, please let me know. And you can always stop me in between for any queries. You can always send a message if you want, if something's not clear or anything, if you want me to stop. So I can always stop in between, right? So moving on with our first slide. Now, as I said, OET exam it can be very nerve-wracking. It can be very hard for some people. But the point is, you guys have come here this far. So this exam is nothing. You just need self-confidence to help you get through this exam. You need to calm your nerves down and you need to put yourself together when you're giving this exam, right? Remembering your mistakes, your past, your preparation during this whole duration of exam would just trouble you guys, and then you'll end up missing every subtest. So the key is you need to be confident, believe in yourself, and keep forgetting your mistakes. If you keep remembering your mistake that, okay, I made this mistake in the previous subtest, and you continue your next subtest with the same mindset, you'll end up messing up the entire thing. And you need to make sure whatever knowledge, whatever things you're learning through our sessions and through your own self-studying, you need to be sure that whatever you're learning and whatever you're practicing is well directed, well oriented, and is in the right direction. Because studying without any direction, without any purpose without any orientation can basically end up ruining your exam. Lots of knowledge, lots of skills, lots of learning material in your head, but no idea of how to execute all that on the test day will just mess things up. So just be sure you're aware about the teeny tiny details of the test day, right? So that you don't mess up or you don't panic, because panicking people end up ruining your exam. My first half of the presentation is going to cover points that will help you out before you arrive in the test center. Right? Those things are very important because most of the time people end up panicking on the test venue or during the test when they're not logistically prepared, when they're not oriented, when they don't know about the basic things they need to take along with them during the testing, or what the timetable they were provided with, what was the order of the subtests like in that timetable, how much time each subtest was allocated during that, right? And everything. So so this first half is going to help you out in that. And the second half will guide you through the final steps of the OET testing process. You'll find information about sitting, listening, reading, and writing. I'll help you out. I'll tell you about the breaks that you can take during the test and when you can leave the venue. So I just want you all to sit back, relax, and enjoy, calm yourself down, and enjoy this presentation. And let me know if I'm too fast or if you're getting bored. So moving on to our first slide, we have the venue details. Now I'm going to basically be focusing on this particular slide a lot, because see, once you register your OET, once you book your exam and you register for your exam, right, you need to be sure you're checking your emails regularly. Okay, there's no point in studying if you don't know what your venue, what timetable they've given you, what your venue is, where you have to go, when do you have to go. All of that will be in an email which they provide you with. So just keep checking your emails regularly, because when you go through that email, you know what your venue is, when you have to arrive over there, and what order of your subtest would be like, your subtest will come in which order, right? And the time duration allocated for each subtest, that will all be in that particular email. So make sure you check that email, and even if you don't get it, so just make sure you talk to the OET people, you send them an email that I haven't received my venue yet. Most of the times they provide you this ample amount of time before you test, you get that email, right? But in case you don't get it, just check your spam, junk folders also to make sure you're receiving emails properly. Okay, the next thing is the valid ID. Now, by a valid ID, I mean a valid ID card or a passport, right? Not driver's license. So one thing you need to make sure in case of valid ID is that the same ID document that you're using for booking your test, you need to be sure that you're taking that same ID along with you on the test day. Not like you've booked your exam with a passport and you end up taking an ID card along with you, or vice versa, right? And if you're booking your exam with a passport, take your passport along with you on the test day. If you're booking an exam with an ID document, take that ID along with you on the test day. Any sort of discrepancies will basically ruin your test. They'll not let you sit in the test if they see any sort of discrepancies between the two documents, right? Another scenario is if, for instance, a person, this is like, I can tell you an example. I know a person who basically, what the individual did was, she basically booked her exam with an expired passport and ended up taking a renewed passport to the testing. Now, there was discrepancies between the two documents, right? So she wasn't allowed to enter the test. She wasn't allowed to enter the examination, or she wasn't allowed to take the test, right? And it basically ended up ruining her entire plans of giving OET, of pursuing lab and everything, because she wasn't allowed to sit in that exam, take that exam. So in this case, in case if you have to renew your passport, just tell the OET people beforehand and ask them to change your ID details, right? You need to make sure you're using valid documents and taking the same exact valid documents with you on the test day, because when there's registration process on the test day, there should be no discrepancies. Any sort of discrepancies will not help you at all. It will ruin your day. It will basically mess your exam up. So please focus on this, that you're booking with the same document and you take the same document as well along with you. Next, the stationery items. Now you're allowed to bring certain stationery items with you into the test room. These include non-mechanical pens and pencils, razors, pencil sharpeners, clear plastic water bottles, and you have to put all of this in a clear Ziploc bag. Right? You can take that along with you. A clear Ziploc bag with all of these allowed stationery items and a plastic water bottle will be great. Right? And the pencils would be sharpened to the pencils because part B and C of reading and listening would, in that case, you would need to shade the lozentas out. So it's great if you take the sharpened 2B pencils along with you. And you're not allowed to bring mechanical pens, pencils, highlighters, correction fluids or tapes, bags, notes or study materials, dictionaries or sources, and any sort of mobile phones, electronic items like MP3, camera, watches, etc. So it's better to take a backpack or any sort of handbag along with you. Just put in all the non-allowed items into it and then just deposit that so that you're good to go into the hall. Now, once you arrive at the test venue, so basically 3 things before I move on to this slide, 3 things before we move on to the test venue. 3 things you're going to make sure before you arrive at the test venue. One, you're checking your emails properly and you're basically, you know your venue, your details regarding the venue, your timetable. It's better to get that email printed so that you have it in your hard copy also, your entire timetable with you. Secondly, your valid ID document. The same document that you use for booking your exam, the same you're going to take it with you on the venue, right? And thirdly, your stationery items. The stationery items that you can take include non-mechanical pens or pencil, 2B pencils, sharpened 2B pencils, no highlighters, no calculators, no electronic items, they're not allowed. Just all the allowed stationery items in a clear Ziploc bag and just take that along with you, right? Now, once you've arrived at the test venue, you're good to go till now. You're all good to go. Stay calm, compose, and now you're at the test venue. So once you've arrived at the test venue, a member of the venue staff is going to greet you, and he's basically going to make sure that you're not taking any electronic items with you, and he's going to make sure he can check that you're taking the proper stationery with you and everything. Then they guide you to basically to a waiting room. In the waiting room, before first there'll be a registration process that will take place, right? In the registration process, this is where the ID card, the valid ID document will come into play. Now, over here, you're going to show that same ID document that you basically use for registering or booking the exam, and they're going to make sure that yes, this is the same person, this is the same document, there's no discrepancies, and then they'll direct you to a person who's going to take your photograph, and your registration would be complete, and then you'll be directed with the waiting room. In case of any discrepancies, at this point, you won't be allowed to enter the hall, right? After this, you're going to, once your picture has been taken, your ID document has been checked, you'll be directed towards a waiting room. Now, at this point, if you want to use the restroom, you can go and use it, right? But because after that, you won't have any time and it will just be useless to use it after that, because then obviously it will just mess up your whole time management and everything. So it's better to relax yourself, to calm down. If you want to drink water, go to the restroom, just do it at this point in time. Now, once everybody has been through the registration process, you'll all be directed towards the examination hall, and over there your desks would be allocated to you. Okay, so far, no, any confusion? If you guys want me to stop or want me to repeat anything, I can do that. Otherwise, we can move on. Right, we can move on. So once you're in the examination hall, you're going to take your seat. A desk will be allocated for you, so you can just quickly find that out and just take a seat. Once everyone's seated, the invigilator is going to read a set of instructions out for you all, right? Now, one more thing. Just always listen to the set of instructions. No matter if you even don't feel like listening to it, just force yourself to listen to those instructions, because anything can change at that particular point in time, right? Whatever I'm telling you people, all the rules, regulations, and all the instructions and everything, that's not absolute. Anything can change. So it's better to keep yourself oriented, alert at that point when the invigilator is reading out the set of instructions for you all. And if you guys have any queries during that, you can always ask them. They'll be there to facilitate you all. But once the session, the exam starts, nobody would be there to facilitate you. So it's better to just listen to those set of instructions so you know how things are going to proceed on that particular test day. That set of instructions are very critical, and they would help you, understand your process of the exam day very well and will let you know it's very helpful first. Just force yourself, even if you don't want to listen to it. So just force yourself to listen to those set of instructions. Then once the instructions have been read out to you all, for each test, the venue staff is going to hand out personalized test papers for you all, right? And that test paper will basically have on the front page your personal information. So you need to make sure all the information written on it is correct. In case of any sort of discrepancy, in case of any sort of misprinting, any sort of other query, you can always ask the person who's there to facilitate you, to help you out, right? But you don't have to sign the candidate declaration unless or until you're sure that everything written on it is 100% accurate, it's exactly fine, there's no misprinting, everything is clear. So that is very important. Then you're going to sign your candidate declaration. Right? And in case of any sort of query, if you're confused about any information, if you need any sort of assistance, just raise your hand and ask the invigilator. They'll definitely help you out at that point. Okay, now the next question is, after this, the next question is, in what order my subtests would come, right? So the most general order, or the order that's mostly followed in most of the venues, is that first you get the listening, you go through the listening subtest, then the reading subtest, then the writing subtest, and then the speaking subtest, right? But this is not absolute. Like I said, the first email that I was talking about, that has your entire timetable. So that email contains your order of subtest along with the venue details, along with the time allocation, the time duration for each subtest. So just make sure you check that timetable on the email so that you orient yourself accordingly. Because if you would not have the basic orientation about, okay, what my first step test would be regarding, would be listening or would be reading, then you can't orient the information in your head. You cannot, order that information in your head if you wouldn't know what the order of your subtest would be like. So it's great if you know your timetable and then you basically prepare yourself according to that particular subtest. So mostly everybody is going to get the listening subtest first, then the reading, then writing, and then speaking. Speaking is always the last one. But then again, this can change and it's not absolute. So moving on to the listening subtest. Now, our first subtest was a listening subtest. Now, once everybody has signed the candidate declaration on the front page, the venue staff is then going to conduct a sound check, right? At this point, you need to make sure that you hear during the sound check, you need to make sure that the volume is fine, you're hearing everything clearly, and there is no technical issues at that point in time, right? If there's any sort of issues, you have to ask them you have to tell them so that they can address it there and then. But if you don't tell them at that point in time, then it can basically, nobody's going to facilitate you during the session, during your test, right? So just make sure you hear everything clearly, the volume is fine for you, and you can always ask them to increase the volume, to decrease the volume, or for any assistance, right? So once this sound check has been done, your listening subtest is going to start. The listening subtest consists of 3 parts. There are a total of 42 questions in it, and all these questions are based on general healthcare topics that you all would be very familiar with, right? So the total duration of this subtest is 50 minutes. And basically, this subtest is going to have, it will include time to listen to the recorded conversation and for you to answer the questions. Now, remember one thing. You have to answer the questions there and then, right? Once the audio will be around 40 minutes of length, listening audio is going to be about 40 minutes in length, right? And there'll be lots of pauses and lots of spaces and pauses during the recorded speech, so that you can basically quickly write down your answers. So remember, you have to write your answers there and then and immediately, because if you won't do that, at the end you won't get any time to basically write down the answers to the questions you've missed. So it's better to basically go in a sequence and start filling up with whatever you think is the right answer, all your question on your question booklet with, right? Because if you basically miss, sometimes we think, okay, I can always come back. I'm just going to miss it for this time period. I'm going to miss this question, and I'll always come back to it in the end. But that time won't come because the time duration is so particular that you have to manage it efficiently, and also because the recorded audio will be going on, and you'll end up losing track of the previous audio and the previous question, and it'll just mess things up. So it's better whatever you think at that point in time is the right answer, just write it down. Don't leave that space blank. Just fill it with something what you think is right, and just go to the next, and try to manage your time appropriately. You can complete listening part A with either a pen or pencil, but for part B and C, you'll have to use 2B pens that you brought with you. And for part A, like I said, the big question booklet, you need to write your answers in the space that is provided below each question. But for part B and C, you'll have to shade the lozenges because that's completely fast. And if you end up writing part B and C's answers somewhere else other than the lozenge that's provided to you, that will not be marked. So make sure you're writing your answers in the appropriate place. And you have to write your answers, I'm repeating again, as you listen. Otherwise, it'll just mess up your entire listening subtest. Now, one important perk that you can enjoy in case of listening subtest is the spelling mistakes. So in case you make any sort of spelling mistakes, it's okay, no need to worry because it won't be penalized. Your marks won't be deducted for it, right? But make sure that it's comprehensible for people. Don't make such huge spelling mistakes that nobody in the end gets to comprehend what you've written. So any sort of little bit of spelling mistakes are you're okay with. And same is the case with abbreviations. Any abbreviation that's most commonly used in our professions, like BP or something like BP, any sort of these small abbreviations like BMI, BP, and all these sort of abbreviations, you're good to go. You can use them in the listening subtest. But anything that out of the blue, any slang that you're using, any random abbreviation you're trying to fit in or making it up by your own self, at that point in time, that won't be accepted. Your marks will be deducted for that, right? And at the end of part C, you have 2 minutes to check your answers. So to answer to all parts of the subtest, including making changes to check, you can basically, at the end of part C, you have just 2 minutes and you can go through your entire paper and you can basically check your answers at that time. And once your time is done, once your 50 minutes are done, you will be asked to hand in your papers, and you're going to put your pen and pencil down, and the vigilators will then collect all your papers. Right? So once you're done with the listening subtest, just take a deep breath and calm yourself down and forget the mistakes. Don't take those mistakes along with you in the next subtest, because then you'll just ruin your next subtest also. So start the next subtest with some good new energy and with a positive mind, with new energies, and then with new motivation, you can start your next subtest. So now we're forgetting about the listening subtest and its mistakes. We're going to our next subtest, that is reading subtest. Right. So far, any sort of query? Okay, no queries. I'm assuming you all know, you all are very clear about whatever I'm teaching you. And okay, so the reading subtest. Now, before the reading subtest, now, like I said, with new energies and new motivation, you have to start your reading subtest. You guys are great. You guys will do great in this subtest as well. And we're forgetting about our listening subtest. So now the invigilators over there, the one-year staff, they're going to read out a new set of instructions for you. Then again, I'm going to repeat, listen to those instructions very carefully. Even if you don't want to listen, just force yourself and listen to those instructions, because anything can be new in those instructions, anything can change. There can be a new set of instructions for any testing. So just be sure you're listening, to make sure you're listening it carefully and you're listening and comprehending all the information they're telling you about that particular subtest. It will be very useful for you, okay? So reading subtest again has 3 parts. The total time for this subtest is 60 minutes. Part A is for 15 minutes. Part B and C is for 45 minutes. And the total number of questions that are there are 42. Now part A, the total marks for part A are 20. The part For part B, it's 6, and for part C, total marks are 16 marks. Now remember that you're not going to be allowed to leave the room during part A or in the first and last 10 minutes of reading part B and C, right? So, and it's also not advisable, because then you're going to just, your time will be wasted and there's no point of, you'll just mess up the entire exam. So it's better to stay there and just calm yourself down over there, right? And firstly, in this case, now see, in this case, the part A's question booklet will be handed to you, the reading paper will be handed to you first, right? Once you're done with that, part A's paper will be taken away from you, and then part B and C would be handed back to you. And for part A, also, you're going to use a pen or a pencil. But for part B and C, you can use 2B pencils, right? Because in this case, also, you have to shade the lozenges. Now, one thing you need to make sure that once you're doing your part A, so just check it there and then and write your answers and check it, because once the paper has been taken from you, you will not get that paper again. So once you're done with part A, make sure you have enough time to go through your paper for changing any sort of things you want to change that in your answers, and then your papers will be taken from you, right? And in this case, now in the listening one, you were enjoying perks of spelling mistakes and abbreviations, but in reading, you're not allowed to make any sort of spelling mistakes. Making any sort of spelling mistakes will basically result in deduction of marks, right? So make sure you're writing you're writing all the words with the correct spellings, and you're not using abbreviations which are not accepted, right? And you have to, in part A, you have to make sure that you're using the same form of word or short phrases that are given to you in the core test. You don't have to write anything from your own self. You don't have to make up things. To use the exact same words and exact same short phrases, right? And like I said, you won't be giving any extra time at the end of the subtest to check your answers, so you have to manage your time accordingly. Now, 15 minutes, after 15 minutes, part A materials will be collected, and then you'll be given part B and C. And then you have to do your part B and C, you have to fill the lozenges over there. You have to shade it up and for the part B and C. And once you're done, your 60 minutes are over, you need to calm yourself down once again, forget about all the mistakes you made in the reading subtest, and with new energies and new positivity, you have to go to your next subtest, which is the writing subtest. So far, is everything clear? I hope you all are not bored. I hope I'm making things clear for you all. Right. So, should we start the writing subtest? Okay, so the writing subtest is for 45 minutes, and it will be very specific to your profession. You all would be well aware of the writing task, because everybody is going to get a writing task based on the typical workplace situation, right? And the papers are going to be given out by profession, and they'll tell you, you'll have time to read your task, right? And basically countdown will be started once you're writing, when at the end of 10 minutes will be left, or when 5 minutes is a countdown is for 10 and 5 minutes is going to be started by the venue staff. And you cannot write anything during the first 5 minutes of the test. Now, the 5 minutes of the reading, initially you will get 5 minutes for reading out your task in your case notes, so that you can plan your response accordingly. And it's basically, this time it's important to use that 5 minutes very very efficiently, so that you can basically understand what they're asking you to write and how you need to execute your writing skills and your knowledge for that particular task. You have to plan your response to that particular task, right? And the tasks that they're going to give you would be designed in such a way that that 40 minutes are going to be enough for you to write a response of that particular length, and there'll also be enough time for you to check what you've written. Okay, so if you have to during the reading time, you will not be allowed to consult like not just during like basically the task and the case notes will be provided to you. They'll be always there for you. So you can always go back to read those for reading those tasks and the case notes so that you can just make sure you're writing the right thing. And spelling mistakes in this case would also result in marks deduction, abbreviations as well. And if you're overwriting or underwriting, that is not going to result in any sort of marks deduction. But the point is, if someone understands the task given to him or to them, and if they can comprehend the case notes and they understand what they're supposed to write, they'll always end up writing the required line length and within the word limit of 180 to 200 words, because they know, okay, what the task is asking them, what the task is and what they're supposed to write, right? So like, for instance, if we get a question in an exam and we don't know the answer to it, so either we end up writing irrelevant information just to compensate the fact that we don't know the answer to it, so we end up writing irrelevant information and not the exact answer, right? Or we leave it blank, or we write very precise something that, something very limited and something very precise, because we don't know the answer, we don't know knowledge. So if someone knows the answer to a question, they're going to always use this appropriate words, and you always give the appropriate answer to it within the word. So same is the case in your writing task as well. If you know the answer to the task given to you, if you have understood the case notes properly, you'll end up writing it with the same word range for the task that's allotted for the task, that is 180 to 200 words. So make sure you're using your time, you're managing your time properly, and you have enough time for checking as well, and you are executing your plan, the knowledge you've learned appropriately at that time. Just don't panic, stay calm, and once you're done with the writing subtest, you're good to go for the speaking subtest. But before that, take a deep breath, calm yourself down, and just forget about the mistakes you made in the previous 3 subtests. So we're on to our last section of speaking subtest. I hope everything's been clear so far. Yeah, please feel free to write here any queries in the chat box. We'll be always there, our entire team, the mentors will always be there to help you all out, and we're all open to feedback. So in case you want us to cover any topic, if you have any sort of objections or queries regarding our teaching style, or you want us to cover get some other sessions or extra sessions, or you want us to cover some other topics or some other mode of teaching you want us to introduce, we'll always be ready to accept that, and we'll always be ready to improve ourselves for you. So do let me know if the session was useful and what your feedback was regarding this session. I'll try to be better for the next session. And with this, we move on to our last subtest, that is the speaking subtest. Now, for the speaking subtest, it will be for every individual. It will you must be aware of it. Okay. So for the speaking subtest, there'll be a room where you'll be there, where the interlocutor will be there to meet you, and a recording device is going to be started before your ID check, right? So the interlocutor is going to make sure you're calm, you're not nervous. He's going to greet you, he's going to make you relax, he's going to ask you a few questions. So you don't need to panic at that time, you don't need to answer that very very cautiously, because that's not your mark. It's just for you to stay calm and composed, and for you to relax. You've done great so far. This last subtest you're going to ace it as well, right? And each profession will have specifically designed materials which will be based on real healthcare scenarios, and the total duration of this subtest would be of 20 minutes with 2 role plays in it. So firstly, what are the so once you're seated, your recording would basically would be started, right? So you'll be given 3 minutes to read through the card, and if you want to ask the interlocutor anything during this time, you can clarify all that. If you don't understand anything, if you want to make notes about what you're going to ask, how you're going to proceed the things, you can write it down on those cards, right? And this card is basically going to include definition, pronunciation about words, etc. But not, it won't give instructions about how you should complete the task. So that's all about how you execute your knowledge and ideas. And each role play is going to be about 5 minutes, so a total of 2 role plays going to be there. And you won't be aware of the time you won't be aware of the time during the speaking subtest. So you just need to keep talking to the interlocutor. Just be yourself, keep talking, keeping yourself, keep him engaged, and then the interlocutor will just tell you to stop, right? When the time is going to be over, he'll tell you to stop. So you have to repeat the same process for the second role play card as well. And now remember, you don't have to panic because that interlocutor is not assessing you, right? Your entire test is being recorded, and later on, the assessment team is going to assess you. So just be calm, composed, and even if you're making mistakes, just don't show that you're making mistakes. Just be confident and believe in yourself, and just keep on talking and using your knowledge and executing your knowledge appropriately, because that will help you out. And you can make notes on the role play cards if you want. You can refer to the card anytime during that role play. And once you're done, you have to return the card to the interlocutor at the end of the role play. So if you're unable to complete the elements of the role card or the task, there is no need to be tensed about it. There is no marks deduction for it. But it's better that the more elements you're covering, and that means that you have a better understanding. You can understand what the tasks were assigned to you, and you have an understanding of how to execute that, right, when you're talking to someone. So that will basically show them that this person has understood the elements on which were the tasks that were assigned to them, and this person is able to communicate in spoken English, right? But even if you are unable to complete those tasks, it's okay. You just need to be fluent. You just need to make sure you're talking things and taking the things in the right direction, and just be confident and believe in yourself. You guys have come so far. You'll inshallah do great in the future as well. And this exam is just a piece of cake in front of all the difficult exams that you gave to get so far. So there's nothing that's going to stop you from acing this exam. Right, so the purpose of these two scenarios, that why do they have two role plays? It's because so that they can basically check your diversity. They can see they can have a broader view of your spoken skills, right? And how you can, they're giving you two chances. Even if you mess up one chance, you can compensate for it in the other chance, and they're not going to judge you on the basis of just one messed up role play or one play where you're not covering the elements. The other one is an open option for you to cover everything up, to basically orient yourself and use different kinds of languages, different suite of expressions, and give a broader aspect about yourself and your spoken skills and all the knowledge that you've learned so far. So now you can all relax. It's over. So once you're done with it, your time's up and you're good to go. You're done with your OET. You've done great. No need to think about your mistakes that you made, and just forget about it. You're not supposed to speak to any candidates. We're still waiting to complete the speaking test, right? So with that, our session's also ending. Now you can all relax. But in the end, I would like to say that just trust yourself. You know more than you do. Don't stress yourself. Just forget everything, all the mistakes you're making, and just give your best and just be confident. Once you're confident, everything is going to go in your favor. The more self-doubt you're going to have, the more mistakes you're going to remember for each subtest, and the more you underconfident you are, the more mistakes you're going to make on your test day, right? So it doesn't depend upon what sort of preparation or knowledge or skills you have. It all depends upon how calm and composed you are on test day, and how you are basically taking yourself through different subtests, and how logistically prepared you are. You're taking everything for the test day. Your checklist is complete. You're checking your emails. You're using the same documents. You're not creating any sort of those sort of issues for yourself, and you're good to go. And you need to be confident. This exam is not difficult at all, and we're trying our best to provide you with the best ways to help you through this proper guidance so that you can ace your exam. And